Hello friends, welcome to Creative Medicine. In this lecture, we will learn about early onset and bad prognosis is seen in. Early onset and bad prognosis is seen in. Okay, we will see each of them. Okay, catatonic schizophrenia is actually it has mostly motor symptoms. Okay, because it has motor symptoms, it has early diagnosis, not onset. Okay, because it has early diagnosis, it actually has best prognosis. So this is not the answer. Next, hebephrenic schizophrenia. Hebephrenic schizophrenia is actually a disorganized form of schizophrenia where the personality is affected first. Personality is deteriorated. Okay, here there is early onset. In this, the patient will have early onset. Okay, and there is poor prognosis is seen because the personality is affected. So early onset, poor prognosis is seen in hebephrenic schizophrenia. In paranoid schizophrenia, it has most commonly positive symptoms. Because it has positive symptoms, it is diagnosed early, but it has late onset, and because it can be diagnosed, so it has good prognosis. So here undifferentiated schizophrenia is the one which cannot be differentiated. Here in hebephrenic schizophrenia, you will see early onset and poor prognosis is seen in hebephrenic schizophrenia. Thank you, and thank you for watching.